Hi, everyone, and thank you for joining us. My name is Anna Kinsey. I'm your host for KCHC Pulse, Episode 6. And it is my pleasure to introduce our CEO, Suzanne Freeman.
Hello.
Hello. Thank you so much for joining us today. An exciting week. Exciting week. We are celebrating National Health Center Week. And we're doing that all week long. Mm-hmm. And so the National Health Center, Community Health Center Association actually gets this going for all the community health centers around the country. And this is just a little bit of knowledge sharing with you all. So there are 43 community health centers in the state of North Carolina and with over 500 service delivery sites. However, in the country, there's actually 4,500 community health centers with 15,000 health center service sites, and then they serve 30 million patients altogether. Wow. That's amazing.
Yes.
That is amazing. So we're having fun this week, and we'll go a little bit more into what our activities are. But right now, thank you again for joining us, Miss Suzanne. So you have been with the center for a total of how many years?
12 years.
But you are now our CEO. Mm-hmm. And been the CEO for how long?
For less than 2. 2 years will be October.
But you feel like it's been a lot longer?
It does feel like it's been a lot longer.
A lot longer. That's a lot of responsibility.
It is.
Well, you're doing a great job.
Thank you.
And we appreciate you. So tell us a little bit about the health center and why is the health center here? How did it end up in Kinston?
Yeah. So back in the early 90s, there were some community leaders and some meetings going on, and they were discussing the teen pregnancy rate and how high that was and some other health needs that were needing to be addressed. And these meetings were held a lot at St. Augustus, and Reverend Melvin Tate had just moved to the area, and he was from New Jersey or had moved here from New Jersey at the time and had been serving on a board for a community health center there in New Jersey. So he knew about health centers. And so, attending these meetings, he recommended that we look at to starting their own health center. And so with the support of a lot of community partners and leaders, the health center was started, and that group of community members, and including Reverend Tate, served on the initial board for the health center.
Wow. That's actually amazing. I think all the community health centers have actually started because of concerned citizens, mm-hmm. community members, other organizations maybe, coming together and brainstorming and seeing the need of the community, right?
Yes.
So how has the need of our community changed over the years?
So, like I said, at the time it was focused on the high rate of teen pregnancies, but there's been a lot of needs throughout the years. COVID is a good example of how needs change and how fast those needs can change. But we do a community health needs assessment every 3 years to look at what the current needs are. Our most recent needs assessment was done in partnership with UNC Lenoir and the health department. They headed that up, and lots of community members were involved in that to get the data that they needed. But that showed that the three major needs for now, number one was mental health. Number two was physical health, and including chronic needs, chronic diseases, and obesity and cancer. But not only that, but health care access. And then the third one was transportation.
So when the center was opened, what services did it provide at that time?
So they opened up providing medical services and OB/GYN services.
Well, wow. There have been some benchmarks over the years, haven't they? Mm-hmm. So tell us about those.
So eventually dental was added, and Dr. Junius H. Rose had a big part to play in that. He contributed a lot of support and time. He volunteered working in the dental department one day a week for many years, and he also served on our board of directors for probably close to 20 years. So our dental department is actually named after Dr. Rose. And then later, 2019, we were actually able to start the school-based oral health program, and look forward to next year getting a dental mobile unit with 3 dental operatories that will allow us to continue to grow those dental services in the community. And then going back, in 2005, our community outreach department was started, and that allowed us to offer certain enabling services like transportation, interpretation, and focus on health education. Then in 2019 also, we were able to start, what was in 2019?
Was that behavioral health?
Thank you. So,
see, we've had so many great things happen. It's hard to keep track of the timeline.
In 2019, our behavioral health department really started expanding to the point where we actually had to get more square footage for that. And that was under the direction of Dr. Brandy Harrell. We increased our psychiatric services, our therapy services, and we added substance abuse services thanks to Dr. Julius Millette.
Who was just recently retired.
Yes, he just recently retired. We celebrated him a few weeks ago for all of his work and support over the years at Kinston Community, just because he added those substance abuse services 2019, 2020. He actually served as in our OBGYN department for many years before that, and he was our chief medical officer at one point. So.
Now, was he focused on substance use disorders in pregnant women as well?
Initially, he actually started some of that while he was working here as an OBGYN Services. And then he left and expanded his practice of that, and then came back and offered it to everyone, but including, he continued to offer it to pregnant women.
Well, what makes the center tick? How many employees do you have?
So we currently have right at 100 employees.
Wow.
And we see around 8,800 patients.
I remember that number pre-COVID was almost 10,000, wasn't it?
We had gotten up to 10,000 before. COVID had its impacts to everybody. And then we've also had turnover that has led to us being able to see around 8,800 right now.
Because right now, do all of our departments can someone just come in, call, or come in and be seen at the center? Or is there a waiting list?
So for most of our services, you can call and get on the schedule. Dental is a little challenging right now because there's a high demand, and we don't have enough providers to meet that demand. Excitedly, we are adding a dentist next month, actually, and then with the help of the mobile unit that we get next year, we hope to be able to meet the demand.
Well, I'll tell you, we had spoke earlier about the meetings that I go to in the community, and the dental need is definitely out there. And I have been spreading the word about our dental mobile unit that's going to be coming in 2026, and folks are very excited, very excited.
Yes, our dental director is very excited.
I know he is. And we've got our mobile medical unit that you mentioned.
Yes, we were able to get that in 2021, and initially we used that for COVID and for going out and doing COVID testing, COVID vaccinations, COVID education, COVID treatment, and then we were able to focus on using that more as a medical mobile unit, and we're continuing to work on growing that program.
Taking the care to them, taking the care out to the community, that breaks down barriers right there.
Yeah. I mean, transportation is one of the highest needs in the community. So.
And I think that's a great service that we provide. How do you think that our community needs have changed from when our center first started until now? I know you mentioned the Medicaid and the pregnant women, but anything else? Has it changed? Has it evolved over time where you see, well, you know what, in the future, this is what I need to think about?
Yeah. So, I mean, I think one example of that is telehealth. We didn't do much telehealth. The only one, well, we didn't do any telehealth at that point until COVID. And then we had to learn quickly how to do telehealth. And we still offer those services, and especially in behavioral health. There's a lot of patients that really still like having that option. Some patients want to be seen in person, but that is still a good option. And medical offers telehealth. So there's visits where you need to come in and you need your labs and you need to be seen in person, but there are visits that are easily done through telehealth. So that having that as an option is great.
I think it would, now that you're talking about that, I think it would be beneficial to talk about our program that we have where we provide our patients with hotspots should they need them, right?
So we are constantly looking at grants to support our patients, including prescription copays, including vouchers, food vouchers. And one of the grants that Anna is referencing is related to remote care, remote patient monitoring. We have that going on. But for those patients that struggle with transportation and that can have the telehealth visits but don't have a way of connecting, then we have a grant that allows us to give those remote hotspots out.
And you also provide digital literacy for our patients that need that. If they want a hotspot, we can give them a hotspot, but it doesn't mean they know how to use it, right?
Correct.
So the Community Health Center also provides that digital literacy, which is great, because a lot of the elderly may have challenges working with that.
We saw that a lot during COVID with ramping up our telehealth program.
Suzanne, tell me what your vision is for our Community Health Center in the next 3 to 5 years.
So we have a lot of potential for growth. I've always heard if you've seen a health center, you've seen one health center because they're so different in what they can offer. But I would like to see us continue to iron out our current programs, expand our current programs, and then start looking at what other services that we can provide for the community.
What other services come to mind right now?
So X-ray is one that our providers would love to be able to offer. Urgent care is another, but specialties. There's so many specialty needs. There's vision, gastro. We currently have a cardiology provider,
Dr. Pradeep, right?
Dr. Pradeep, who volunteers his time
Absolutely.
To the health center. He's been doing that for several years now, and it's a huge benefit to the center and to our patients. And
I think we need endocrinology too, right?
Endocrinology would be huge. Because our patients, we have so many patients uninsured, our providers tend to try to treat the whole person and try not to do as many referrals. And because of that, it can be overburdensome for the provider. So to be able to have those specialists that can see those patients without those high costs would be a huge benefit.
So we're talking about burden on the patient. We see anybody and everybody. They can be uninsured, underinsured. They can have Medicaid, even have a third-party private coverage. But what else do we offer that can help our patients?
Yeah, so we have a sliding scale based on a patient's income that they can sign up for, even if they have insurance. Sometimes there's benefits in using the sliding scale over insurance due to high copay. So they have that option to sign up for the slide scale, and they get reduced costs for all services, labs, not just the visits themselves, but the labs, the pharmacy. And we even have some agreements with outside agencies like LabCorp and the radiology office where sliding scale patients can get their services discounted there as well.
And that has helped many, many, many of our patients.
Yes.
I know that our patients will sometimes, they have that barrier where if our provider refers them to a specialist, then they have to make a copayment. Mm-hmm. And that copayment is so huge, they can't go. Right. So they're not going on purpose because they just don't want to go. They're going because there's barriers.
Correct.
There's those barriers, and we help to address those.
Yes.
And I will do it if you're not going to, but I want to put a plug in. We accept volunteer providers. I don't know if our community realizes that. Maybe yes. Some, not all. But Suzanne would welcome a call Absolutely. From any provider that would like to volunteer their yes. time. We mentioned Dr. Pradeep earlier. He volunteers his time, mm-hmm. and Suzanne greatly appreciates that. So we might need to do a plug and do your email maybe later at the end.
Exactly.
You know, so you can contact Suzanne and let her know if you'd like to volunteer. Okay, well, we have talked about the past, we've talked about the present, and we look forward to the mm-hmm. future and where you lead us. And so that's very exciting. And I'm so glad that you could join us today. And I hope that you all will continue to keep in touch with us via our Facebook page or our Instagram. We have a lot of fun activities that are scheduled for this week during National Health Center Week. Mm-hmm. This is the week that we recognize our staff, our employees, and let them know how much we appreciate them. And we just, what do you want to say? We want to say thank you to them every day, but we're so busy that there's not enough time. Yes. But we want them to know how much they're appreciated for their mm-hmm. hard work and dedication.
We have a great team.
Yes, absolutely. And for our patients, thank you for choosing Kinston Community
mm-hmm.
Health Center as your medical home. We really appreciate you. And this Saturday, we will close up National Health Center Week with our, I think it's the 17th or 18th, Community Health and mm-hmm. Resource Fair. It's going to be right here at the center, 324 North Queen Street. It'll begin at 10 and end at 12:30, 1 o'clock. School supply giveaway is going to be happening, but come early. Supplies may not last the whole event. So hope to see you there. Thank you for joining us and have a great day.
Thank you.